Welcome, everyone. It's a real pleasure to be taking part in this international educational collaboration today. And my name is Alexander Leeper. I'm a consultant oncoplastic breast surgeon in the UK in a hospital called the James Paget University Hospital. It's my absolute pleasure to welcome Professor Jerome Pereira, who has been a mentor of mine and a colleague now for 5 years. I've learned a great deal from Professor Pereira, and I'm sure that many of you in the audience will have had experience of his wonderful teaching as well. I might turn to you, Professor Pereira, and ask you, tell us a little bit about your experiences in education and training and how you found yourself providing such a wonderful platform.
Thank you, Sandy, for that kind introduction. My first foray into education really started about 25 years ago. I was a tutor on the Farcius course at the Royal College of Surgeons of London. And at the time, I was invited to be a part of the faculty that developed the first distance learning program for breast surgery. And I felt excited to join that program purely because I was conscious that breast surgery was an emerging specialty, but trainees were not very interested in joining the program because they felt there was a very limited number of operations to offer, and being surgeons, we all would like to do the big stuff. At that time, in fact, a couple of years earlier, I had embarked on doing immediate reconstructions, being one of the first group of surgeons in the country to do these operations, and I could see the potential for breast surgery not only to help patients to improve the quality of their lives, but also could make it a very interesting specialty for young trainees. So I joined the faculty, and I was instrumental in writing the section on breast reconstruction. And that course really became a great success and became a model for other specialties like colorectal, vascular, etc. So that was my first foray into medical education. And then at the same time, I had the opportunity of joining the curriculum development team for the development of medical school at Norwich. So that really gave me a great experience in developing curricula, particularly surgical curricula. And I was able to establish medical school at this hospital. So it all became fascinating. And I'm most grateful to my mentor, Professor Sam Leinster, who was the inaugural dean and is currently my co-director for the Blended Learning UK programs.
That's really interesting to hear about the progression into the world of education and training, which ultimately you sort of scanned the horizon and you could see that this speciality was evolving actually quite rapidly and that there was a bit of a space in the market to deliver this education. How was it that you identified what patients wanted and what the current practice was in the UK? That must have been quite important to help direct you into creating a program.
Yes, Sandy, I had the privilege of being the originator of the National Mastectomy and Reconstruction Audit in the UK. I started this as a regional audit with my own practice, and subsequently the UK government funded a national prospective study on the outcomes of breast cancer surgery. And we are looking at two areas. One is the surgical outcomes and patient-related outcomes, PROMs. And very early on in the study, I noted a worrying trend in the sense that there was certainly gross variation in outcomes among trained surgeons. These consultant surgeons' results were so variable, I felt there was a need for us to bring in some more education training. And that was a very, very great stimulus for me to approach the University of East Anglia. And very fortunately, they approved the first master's in oncoplastic breast surgery, which was and still remains the highest qualification in the UK and abroad. So that is my first experience of getting into breast education.
It would be fair to say that the National Mastectomy and Breast Reconstruction Audit provided a benchmark really on which surgeons could measure their own performance.
Yeah.
And as a result, upskilled the breast surgeons who may have realized that some of their practice was not up to that of some of their colleagues.
Absolutely, yes.
But it was interesting that you also took on not just what the surgeons were doing, but what the patients were experiencing. Why did you go down that route?
It's a bit historical. My research, before I came to clinical practice, I was a researcher at the Royal College of Surgeons. And I had the privilege of developing an operation to restore sensation in leprosy. What had happened was my patients were, this operation was successful, but and patients in different parts of the world were all saying the same thing in terms of we feel heat, we feel thorns, etc. The operation was protecting them from damage. But because of lack of electrical activity in the nerves, I was shot down at many international conferences. And that impressed upon me the importance of listening to patients. So when I started doing breast reconstruction, my first reconstruction, I started an audit of prompt for my first patient. What do patients feel in terms of the satisfaction, the quality of communication, the confidence in the surgeon? How confident do you feel after an operation? What were the pain control? All this stuff I put into my first study. And that became the template for the national study. So it is my own experience of patient contact in a different field that focused my mind on developing something in terms of prompts.
And do you feel that proms are quite important as far as thinking about oncoplastic breast surgery and what our aims are for that surgery? Do you think that patient-reported outcomes is an important element to help us decide what we should be doing for that individual patient?
Yes, the proms has been a very well-established tool with work done at the Memorial Sloan Kettering. And we adapted the questionnaires to suit the British public. And it gives us not only an idea of the quality, but also even the complication rates. We assume that we are picking up all the complication rates. But don't forget, we as clinicians see these patients at intervals. But what's happening between the time they're coming up to our clinics, going to see the general practitioners, and we did identify what appeared to be a high infection rate, high implant loss rate, higher degrees of pain they're experiencing, postoperative pain. So very, very important information has come from the patient. And on the basis of this information, we were able to sort of advise on the national guidelines. So the best practice guidelines came out of that. So we did insist that most patients should have good pain control. They should have better communication skills. Patients should be offered a better choice. So a number of factors came to light due to props. So it's very, very important in my book. The sadness is that the outcome of those studies have not been fully implemented in the UK as well, or widely enough.
Well, there's always nice to know that there's room for improvement because it can help us deliver and effect change. I think one of my first memories of being a trainee in surgery with you, Professor Pereira, was after a team brief. I think you asked me to look around the room and to tell you who I thought was the most important person in that operating theatre. And I looked at the anaesthetist and I wondered if it was them protecting their cardiovascular system. I looked at you and I thought, is it the surgeon who's going to deliver the great outcome? But you turned that on your head and you said, no, the most important person in the room is, in fact, the patient who's asleep. This is the person that we want to be looking after, and everything revolves around the patient. And it sounds as though not only have you delivered that in theatre, but also you've delivered that outside of theatre to the perioperative experience, but also to the patients in the preoperative phase where they're meeting breast care nurses, being counselled adequately, and also in the postoperative phase as well, to see how they feel about the reconstruction or the intervention that they've had.
Thank you.
Tell me a little bit about your experiences with the Association of Breast Surgery and how you interact with them.
Yes, I've had a very fruitful relationship with ABS. They very kindly appointed me as the lead breast surgeon for the National Mastectomy Reconstruction Audit, and I have also served on their education training committee. And subsequently, when I started planning the Masters in Oncoplastic Breast Surgery, I had amazing support from the association. In fact, the presidents of the association and various committee members came forward and became part of the faculty. ABS faculty have been very instrumental in developing the curriculum. And we built the curriculum based on the national UK curriculum, which is the ISCP curriculum. And we looked at this curriculum and said, ISCP curriculum, which meets the requirements for the FRCS exit exam, is the first floor of a building. And we want to place a subspecialty floor on top. And that's what we believe we achieved. In fact, our feedback from our students now in over 70 countries have shown that consistently we are meeting the requirements for subspecialty training. And that's the reason why we believe our courses are still very successful.
So your educational and training career had an impact locally on me, learning how to operate, nationally, using the current national curriculum to guide the MS in oncoplastic breast, but also it's had a big impact internationally as well. Would that be fair to say?
A few years ago, we employed a research officer to look at the impact of our programs at a global level. And he identified at that stage that more than 2 million patients have been impacted by our faculty in terms of the quality of care. We've identified that mastectomy rates are coming down significantly. In some countries, it's coming down by about 50% because of the candidates have acquired new expertise, better decision-making skills, more confidence in dealing with the whole range of breast cancer patients. And so we also identified there are other areas like improvement of the career progression, confidence in decision-making, confidence in developing new services. Number of our students have built their own services like new breast units, family history services, etc. So we have got a huge number of data to know that these courses are really impacting our patients in terms of better outcomes.
It strikes me as though you've planted little seeds of expertise throughout the world and then watched these grow, and those evolved into quite practice-changing units throughout the world. That must be a source of great pride for you, one might say.
I'm proud of the fact that so many talented surgeons and colleagues like yourselves have been part of the journey, because I'm a person of ideas and I think I've got the capacity to make ideas into practice, but it could never happen without real quality, committed, dedicated teachers. And the ABS have been phenomenal in the way they've supported me. Not only have they badged our courses, but all our faculty, even today. And many of the faculty have been with us for 15 years. They've been so loyal because they believe that these courses are truly impacting patient care.
And they also evolve with time as well. As practice changes and as we learn from each other, we change our own practice. And I think from my experience taking part in the blended learning and the educational packages, but also in the oncoplastic breast MS, every year you will see new trends emerging and new expectations appearing in patients as well. You mentioned that ABS has badged a few training programs. Are these focused at doctors, or who do you aim to educate?
Apart from our flagship master's programs, I worked with the ABS to produce a course in breast ultrasound for surgeons. My colleague Sue Down has played a very, very key role in leading and developing that course. We have a very successful course for breast care nursing. In fact, that course, after a master's program, the breast care nursing course has been the most successful course with a global reach. We also have courses for GP upskilling. And very, very importantly, we have got courses to improve the quality of aesthetic breast surgery. So we've got 16-week modules in augmentation, breast reduction, mastopexy, complex aesthetic surgery. And we're also working with ABS again to produce more courses. So I think we are truly proud to say that our team are probably one of the few centers in the world that produces a course and delivers courses for the whole MDT, from the surgeon to the breast care nurse, to radiographers, and so the whole team. And also we deliver courses at the highest level in terms of subspecialty level courses for the masters, down to CPD courses, which could be just a few hours.
So really, the role of these courses is not just to upskill the surgeon, but to upskill the whole MDT.
Yes.
And as we were discussing with Professor Sarah Downey earlier, we were talking about how important the MDT role is for fostering respect and understanding of the different strands that come to make up the MDT. Looking into the future, what do you see the role of the ABS and Blended Learning UK, for instance, will take in providing breast surgery services throughout the world?
It's already happening. I'm very excited to work with Sarah as president and a number of colleagues to deliver this global breast training package. We have been privileged to win this grant, ABS and BL UK together, to develop this training package to reduce breast cancer deaths and promote early detection of breast cancer in low and middle income countries. So the global training package, which has got an online element and face-to-face element with workshops, mainly aimed at decentralization of breast cancer services. Currently, most of the services in countries like Zambia and Uganda are led from the center. And this creates a lot of difficulty for patients to get to center and unnecessary delays. So we are in the process of training mentors. These are master trainers to cascade training down to the primary health workers and, importantly, the community health workers who have got direct contact with the patient. The aim is to increase awareness by education training and also empower breast self-examination among the general public. So this program is running as a pilot for Zambia and Uganda, and the aim is to cascade it the whole of Africa, Asia, and the Middle East. We work in close partnership with Global Health Partnerships, and funding agency is Sanofi. So this is a very, very exciting program, which has the potential to save tens of thousands of lives. And so ABS and BLUK are very much involved in this.
Fantastic to hear all about the work that you've been doing in Africa and the development of international educational training programs and packages, Professor Pereira. Are you able to tell me a little bit about your experiences of education in India and your vision for the future of breast surgery in India?
I've had the great privilege of working with Professor Anand Kopika, who's a consultant oncoplastic breast surgeon in Pune. He runs a mission called Prashanti Cancer Mission, and Anand has been our regional convener for the mastership programs, and he has been pivotal in disseminating the information about the courses, and we run a very successful program in India. To date, we've 27 surgeons have completed their master's program. 35 are currently on our books, still undergoing the courses, and this is a very, very exciting development to have such an impact on country from where I've come originally. That's very exciting. The other thing I want to say is that we are in the process of changing the MCH from a 3-year program to a 2-year program with a new university partner. And we moved to a new university partner purely because this new university is more equipped to develop cutting-edge technological advances in our courses. And I think we are very excited to introduce a new format of the courses, and we still want to remain at the cutting edge. We are delighted to say that we won 6 international awards for our programs, and we want to continue winning these awards, but more importantly, we want to impact and improve patient care.
That's really inspiring to hear, Professor Pereira, and I've really enjoyed hearing all about your initial forays into education, how you've taken things forward through both national and international training platforms, and how you see the world will be shaped through our ongoing breast surgery educational packages to deliver really outstanding patient outcomes, who, as you said earlier, really are the center of what we do every day. Thank you so much for your time.
Thank you, Sandy. Thank you.